Okay, so as everyone starts to get on here, we'll get started. So I want to just welcome you. I'm Dr. Brooks, and hopefully you're in nicer weather than I am. It is miserable outside. So tonight we're going to talk about behavior changes and kind of strategies from, I guess, a functional medicine perspective. I am a pediatric practitioner. That's what my license is in, and I'm also a registered nurse. So we're going to be talking about it from that end. I'm not going to really talk about therapy because that's not my specialty, although I love it. So anyway, let's get going, shall we? I had sent you all a message as you're kind of joining that. There's a couple slides I think that are important, so I want to make sure I get those to you. So at the end of our session this evening, I will put the link into the little chat box and you can download it. And also the system will automatically send you that handout after we hang up. If for some reason you don't get that handout, go ahead and send me an email, which you can email us through our website at mychildwellness.com, or you can get us directly. So, okay. So super excited. I have the best job in the world. Just see kiddos tonight. I'm going to just chat a little bit. Like I always say, I'm kind of scratching the surface, so to speak. So just a little bit about me. I have a practice in Dallas, Texas, Whole Child Wellness Center, where I just do pediatrics here. So I focus on early intervention, developmental delays, and behavioral issues. So I have a lot of children that are struggling that come in to see me. And my approach here in my practice is integrative. So obviously, as a pediatric chiropractor, I do chiropractic and craniosacral therapy. But then on the functional and integrative side, I do nutrition, diet changes, supplementation, and functional testing, which is really, really important for the kiddos to see what's going on inside their body, since a lot of times they really can't tell us, right? So I have found, I've been in practice a little over 8 years, and I have found that blending these two traditional and alternative approaches has been amazing at helping kids with the things that they suffer with. So I also authored a book, 15 Things Your Doctor Doesn't Know About Your Child, which you can get on our website. It's also on Kindle and iBooks and all that fun stuff. If you're not a paper reader and you have a Kindle, you can get it. I also founded a nutrient line called Healthy Kids Nutrients, and you can check that website out if you want, and also our practice website. I have a lot of information. We may have some practitioners on the phone tonight, aside from parents. So if you want to get some more information, research-based information about different types of things that I talk about tonight, you will most likely find that on our practice website. On our homepage, actually, you can scroll through and there's tons and tons of different categories that you can press on, and you'll see the research there. So I try to get as much research as I can, not only for parents, but also for other clinicians out there. I also do consulting and, of course, education, which is what I'm super passionate about, which is why I do these webinars for parents, because I think we all can't do the type of education that we want to sometimes in practice, whether it's just time or what have you. So this enables us to kind of sit down once a month and, get some information to you that hopefully will be beneficial. You can also follow me on social media. Most of you may have found out about this webinar through our Whole Child Wellness Facebook page. I do post great information, at least I think so, on our Facebook page, so you can follow us there if you haven't already. We're also on Twitter, although I don't tweet as much as I think some of you do, but I do love the YouTube. So we do weekly short videos. I post them usually on Fridays. I do upload them to our Facebook page, so that's kind of the easiest way. If you are a YouTuber like myself, you can find us on YouTube at Whole Child Wellness and obviously get notifications when we have a new video up. So those are really great. They're anywhere from about 5 to 10 minutes long, depending on the topic. Just answering questions or going through new things or talking about research, different things that I know my parents have wanted to know over the years, or things that I'm getting asked a lot about. I'll try to do a quick YouTube video about it. It helps me in practice. And of course, it helps many of you that are living outside of Texas, out of the state, and even out of the country. So take advantage of those. So tonight, I'm not going to be giving medical advice per se. So please take whatever information I have and try to find a doctor or run it by your doctor before you kind of take action. I'm a big fan of being followed medically by a provider. If you don't have a provider and you want to find one, that can be a little tricky, of course. We have many parents that come to us from out of state. We even have us out of the country. So if you can't seem to find services in your area, you can give our office a call and we can see what we can do for you. Reproductive rights, obviously, is my content and my intellectual property, so it cannot be reproduced without my written permission. So now that we have all that boring stuff out of the way, let's get to the good stuff. So what behaviors do and what we see in our kids. So this, as you probably can imagine, this could be 10 slides long. So I wrote down, and you can kind of scroll through them with your eyes as I'm talking here, but I wrote down the things that most parents are coming in for behaviorally. Most people think that parents call me because I have a very large practice of children with autism. That's not why they call. Most of them are calling because of the behavior. And I always say it's the, behavior usually is the straw that broke the camel's back, so to speak. Parents can deal with a diagnosis of whatever, but it's the behaviors and the daily living with it that they can't take anymore. So those behaviors look very different. And some are very mild and some are very extreme. So I always tell parents, if you see any of these, one of them, I would dig a little bit deeper with your doctor to find out where that's coming from. And that's what I'm hoping to get across to you tonight, is these things that we prescribe for children in, from your more traditional side of medicine, they're really just trying to help you through the symptoms that you're seeing or struggling with. It's not getting to the root cause. It's not helping you take care of the root problem, which in essence would take care of the behavior. So that is what people like myself do in practice. Is we do have parents that come in that are on medications that want to be off, or schools will often say to you, you have to get this under control, or we're not going to allow you to come back. I also have parents that do homeschool, and not by choice. They homeschool because their child is so out of control, quote unquote, that they actually cannot be in a regular school setting anymore. And so you can imagine, as a married couple, or even as worse yet, a single parent, what that would do to you both mentally and financially. So I always tell parents it's so much better to get to the root cause than to go through, having to call in sick and lose your job because you have to go pick up your child at school for bad behavior. Some of the things I want to just talk about a couple of these. Some of them are very obvious and some of them you might read and go, what? And so I want to just go through a couple of these and kind of tell you what I'm talking about for those of you that are unfamiliar with some of these words. The first one I want to just touch on is self-stimulatory behaviors. So these are traditionally, parents will know, they'll say like, oh, my child doesn't do any stimming. They don't hand flap, because that's the most popular thing that we see, I guess, in the media. But self-stimulatory behaviors can be, I have kids that headbang, and I kind of wrote some of these. They rock, they spin, they examine things close to their eyes. Anything that they do repetitively. So sometimes I'll have parents come in and say, well, they're kind of OCD because they do this one, they go to the cabinet, they get this one thing out, they come back, and then they go and they do it over and over and over again. So there's a fine line between stuff that's self-stimulating and then stuff that's obsessive compulsive. So it's important for you to describe what's happening. It's not important for you to know what it is. That's your doctor's job, but to be able to explain it. I do have parents even send me videos or bring videos of the behaviors that they have seen or that they're concerned about on their phone. So if you can capture that on your phone and video it, that is fantastic. It's like gold to us when you come to see us. So just know that just because they're not hand flapping doesn't mean that they're not doing self-stimulatory behavior. So the other one that is equally gross and actually more common than you would think is smearing feces. This is a pain behavior, and pain behaviors can go all over the map. So I'm going to talk about smearing feces and pain behaviors kind of in one. But I have had children poop and then smear their feces on walls. They can't stop keeping their hands down their pants and almost like they're playing with it. that is really a pain behavior. And it will most of the time I've seen it, it comes from children that are nonverbal. So it's kind of, I always say it's their way of really expressing to you, hey, something's going on here. Other pain behaviors that you will see, if you ever see children leaning over a chair, or your child may lean over the couch, may like to hang upside down on their stomach, may like to lay on their stomach and press on their stomach, that is also a pain behavior. Sometimes the way that I always ask parents, does your kid do kind of any funny things that you think are just kind of odd and kind of funny? Maybe you joke about it or whatever. And that's a lot of times how I find out that they're doing some of these pain behaviors or having something going on that is abnormal. Because if you can imagine, those of you that are single, have singletons and one child, if they do funny things like that, you have really nothing to compare it to. So that becomes your normal, right? So anything that you may think is off or not, quote, normal, don't ever be afraid to share that with your doctor. Doing more functional work in my practice, there's nothing that isn't important, if that makes any sense. So you can take some notes on that. So we have all these behaviors. What are the common underlying issues? This is a very short list. And I'll kind of talk about a few things as you're looking through this list. Obviously, processed food is an issue. Meats and dairy with antibiotics and not farm raised, the soil even that we put this in, the pesticides that are used, all that fun stuff. There's genetic predispositions here. I've gotten pretty heavy into genetics probably the last 3 years. And there's lots of amazing things that you can find in a child that will tell you about how to manage them nutritionally, dietarily, and medically from a drug standpoint, right? Kind of what to warn the parents about different drug classes they shouldn't take. That it's very, very useful. We want to keep those genes turned off. We don't want to turn them on and make them manifest, right? So there's so many things that you can do if you have that information. So I'm a huge fan of genetic testing and think that it can be invaluable in a lot of cases. Obviously, a mother's history, this is obviously tough with those that are or are adopted and such. But then you have environmental contributions, things that you do as they grow up, the way that you introduce first foods. Did you formula feed? Did you breastfeed? Did you vaccinate? Did they have reactions to that? Do they have food allergies? Do you live near a waste plant? I know that there is something going on. I think it was an old battery plant or something up about 10 miles north of here. And one of my parents told me that they were actually moving out of that town because they had higher heavy metals in the whole family because of a plant that had been there for a long time. And of course, in Texas, we're just kind of expanding out until we run out of space. So those are some things that are tough to come by. Obviously, things like medications that you use, whether that's over the counter or prescription, of course. A lot of kids have abnormal detox systems. I kind of want to go to that third column. This is pretty common. I would find, and it could be because of the population of children that I see. It's very uncommon, I would say, for me to have parents bringing their kids into me for what I would define as wellness. And if they do it, they're usually the sibling of a child who's having issues and they want all their children seen. But for the most part, most of every child that I see in my practice has some sort of issue with detoxification. Again, this can be very slight to very, very severe. Food sensitivities, of course, toxic exposures we talked about. The three things that I want to kind of drive home by the end of this evening are the things in red. So all in all, the GI is one of the most important components that you could have your doctor look at. The GI system is kind of the radar for the rest of the body. For all of us, not just for children, but children tend to be affected more behaviorally when their GI tracts are a mess. This will obviously affect the nervous system, and the brain will be inflamed as a result. So that's what we're going to kind of be focusing this evening. So this is the best and simple way that I can describe why most children misbehave. And of course, this is coming just from my experience in practice and what I see. there really hasn't been a case of a child that has behavioral issues. And we're talking about that could be inattention, that could be trouble with socialization, that could be anxiety. The behaviors don't have to be aggression, biting, scratching, kicking. They could be, right? They could just be very, very, I guess you would say basic. You know, I have a new kid in my practice that her parents say she's just shy to the point of, you know, almost mutism. And so they want to know what is happening. So anyway, you have digestive problems, which is usually, I'd say 80 to 90% of the time your underlying issue. Then, so if you have those issues in your digestive system, your immune system kind of goes into overload. And of course, depending on the digestive problem is depending on the overload of the system. 70% of your immune system is in your gut. So I would say more than half the time, these children also have had a history of lots of illness, lots of infections, reoccurrence, or, you know, maybe not even illnesses that had to be treated with antibiotics per se, but parents have said things like chronic congestion or asthma or trouble with breathing, things like that. So that maybe isn't quite asthma, but, you know, allergies. And, you know, we say that a lot here in the South. Oh, it's allergies. We blame it on everything. But anyway, so immune system gets overloaded. Now, then the inflammation works its way to the neurological system because the brain and the gut are connected by the digestive system, right? Your esophagus and such. So it doesn't always take a ton of time, but I would say most kids, they're as young as maybe 18 months and up. It just sometimes depends on what the behaviors are and what the signs and symptoms that a parent is seeing. And of course, in most cases, as some of you may have experienced, unfortunately for yourselves, is it also depends on the doctor that you're seeing for primary care, because some doctors will say, grow out of it, this is no big deal, etc. So you don't dig deeper because you're told not to worry, right? But there's something going on with that neurological system. And then, of course, as a result, you get poor behavior, and that cycle just goes like a feed loop, just goes over and over and over and over again. Usually it takes time for the behavior to become an issue. Most kids are either great at home and horrible at school, or horrible at school and great at home. They're usually not bad both places, or both good both places, if you will. So I wouldn't say one's better than the other, right? Having a teacher emailing you every day is a nightmare. And then, of course, having them be angels at school and having them come home and be a devil is always difficult too. So this is another kind of chart I put together to make it as simple as I could. So this is kind of how the digestive system works. We eat food, we digest it, absorb it, assimilate it, and excrete it. So somewhere in these 5 pillars of the digestive system, something is going wrong. Now, for children, eating food can be an issue, right? Picky eating is an issue. Digesting it could be an issue. Absorbing it becomes an issue when I run labs and they have a ton of deficiencies. They're not taking the nutrients from the food, absorbing it, and then, of course, assimilating it, using it in their body for what it's supposed to be. And then excretion is bowel movements. A lot of children are not having a daily bowel movement. So somewhere in here, I have some kids that have issues with every step of this, and some that only have an issue with 1 or 2. So you may be able to answer this question as you're sitting there saying, yeah, my kid has issues with 2 of these or 3 of these. And then there's some parents that as they get older, we really don't know how often they poop, or, you know, we don't have their vitamins checked and things like that. Those are pretty common things. It isn't common for a pediatrician to run the types of testing that I do in my practice, just as a precautionary yearly thing. So don't feel upset by the fact that hasn't been done. It's pretty common that it doesn't get done. So this is how it affects the brain. So we talked about the gut affecting the brain. It does affect it from a digestion standpoint, a detoxification standpoint, and an immune standpoint, of course, all affecting the brain. You're getting those buildup, the neurotransmitters. Those are, norepinephrine, epinephrine, serotonin, dopamine, all those fun things that make us act, sleep, behave, poop, the quote unquote perfect child, which I don't think exists, but as far as this goes, let's just pretend that it does. So these are all the ways, maybe some of these things you've heard about as far as food sensitivities and allergies. That's been a pretty popular term out there online. Food additives, things like colors and dyes. So all of these little things add up to a bigger problem. So the key to health lies in the gut. And that is really what I've proved to myself over and over again through the years. So stage 1 of assessing and treating poor behaviors is paying into these 4 things. So what can we do as parents, or of course for docs on the phone that chose to join us tonight? I put biomedical / functional / integrative care because depending on where you live is depends on the term that's used. So I wanted to kind of include them all because I'm sure one of the 3 I hope you've heard a little bit about. If not, that's okay too, because I'm going to kind of explain to you what it is. So these are interventions that are based on the belief that the symptom that you're talking about, let's just say aggression or inattention that you are seeing, that they're actually the product of a physical issue that the child is experiencing. So there is a quote, there's a reason why. They're not just not paying attention because they're bored. They're not paying attention because there's something going on that's causing that psychological symptom. So what we do is, and I say what doctors of this type of care do is they really look at the underlying issue to figure out why is that symptom happening. And then, of course, refer out for things that they don't take care of, such as myself. I refer out a lot for occupational and speech, social skills, things like that. So a lot of parents are told in the beginning, maybe as young as you can remember, that their diagnosis that they've been given, and this is typically children that are diagnosed with autism or on the autism spectrum, that it's a result of genetics and it's a psychological disorder in nature. So there's really nothing they can do. They just need to come to terms with it and and kind of get on with it. The reason why a lot of people talk about things like autism or other behavioral issues as psychological in nature is because in order to have, and I mean, this is just what I think, but in order to have those types of services for those children covered by insurance, they had to put him under the coding for psychological disorders. So unfortunately, because of that, so parents could get services, now it's the way that it's coded in things is, quote, psychological in nature. Although we very much know that kids' behavior is typically functional in nature. So the second thing you can do is nutrition. And that really is about addressing deficiencies in their body, doing functional testing like urine testing, stool testing, and blood testing with your doctor to figure out what deficiencies are there. And then, of course, from there, I usually do diet changes out the gate. 75% of parents report significant reduction in behavior when their diets have been changed. And there's a bunch of different diet options. So sorry, that's my dog. I brought him to work with me. Come lay down. He's like all of 30 pounds and he's like 150. So sorry about that. So diet changes. I usually do them out late, anywhere from GFCF to Feingold to low oxalate to GAPS, FODMAPs, so many diets, it's mind-boggling. I did do a webinar with docs, I think I did it last month or maybe before on different diets. So I'm trying to kind of help them through some of this too. Gluten free tend to be the most popular one to start with because a lot of children, almost every kid I test, I can't think of one. I'm sure there is, but I can't think of, unfortunately, through my years in practice that hasn't been had a food sensitivity or allergy to or gluten or casein. So they, just statistically speaking, it's a great diet to start with as long as you're following it at 100%. So sometimes I find parents come in and say, we did that diet to do anything. I also know that a lot of times they were given that recommendation without proper education and without proper guidance and someone to call and ask questions to. So I think parents tend to be more I'd say successful when they're under care with a doctor, both from a nutritional and a dietary point. So I would say get with somebody and work through this together. That way you can ask those questions and get them answered appropriately and really be successful. And then the last thing, perhaps for me, the most important, I think, is proper testing. And again, that's going to depend on the doctor that you see. In my practice, we typically start with urine test stool testing that parents do at home, and then we send them out for blood work. And that's kind of how we get started. And for me, it gives me a really good functional look at a kid's body, what's going on digestively, what's going on with vitamins, minerals, and the body function in general. So this is where I would start, as I would find somebody to help you on this journey, because it's a journey. It's not a race. It's not who's going to get there the fastest. It's who's going to get there and well. And some kids take 6 months, some kids take 24 months. It just kind of depends on what you have going on. And most importantly, whenever you go to seek care, you need to be consistent and you need to be compliant, because the body doesn't work like a 5-day Z-Pack or cured of your sinus infection. It isn't that way at all. It takes consistency, and it takes, you doing it every day, right? And then compliance, doing it exactly the way that you were told to do it, because that's what it takes. So be ready to kind of gear up and make some changes, and hopefully with the right practitioner, you'll have that support so you'll be able to be successful. Red flags. So this is one of the slides that you guys are going to get after, because I think sometimes you really have to think about these things. So are you getting complaints about violence and poor behavior? Are they sleeping? Meaning, are they falling asleep easily and staying asleep all night? If both of those are not yes, then there's a problem. Are they a picky eater? That's a big problem. That's a sign that, that's a behavior that's no good. That's a sign that they are in pain, whether they know it or can explain it to you or can verbalize to you that they have stomach pain. I always tell parents, if they've had stomach pain since they can remember, how would they know if they have a stomach ache? So picking is a sign that you need to look a little bit deeper. Do they have bowel movement? Really, if you don't know, and I'd say most parents don't know past about the age of 6, because they start being able to wipe themselves in a way that, is sufficient. I would make what I like to fondly refer to as a poop chart. I just print a calendar, snap like a monthly calendar from your computer, give them stamps or stickers, and every day that they poop, they just put a stamp or a sticker, and you can, tape it to the back of your bathroom door. Very easy, and it's there. And I find that works really well with the kids, because it's right there, and then they can rip that off before their next appointment and bring it to me. Parents just take a picture of it. Other parents scan it to me. But it's a really good way to know, because past that point, a lot of parents say, they poop fine, and you'll ask the kids, so do you poop every day? Yeah. And then you'll start keeping track and you realize they only poop like once a week. So it's pretty amazing what we don't know that's going on. And they don't really have a memory. I mean, when it comes to pooping, they just do it or they don't. So are they hard to manage, both, at school and at home? Do they struggle with completing tasks? And these are tasks they don't want to do, not a video game, which I know that they want to do, but really a task that has to get done for school or otherwise. Do they get angry or show anxiety easily? And this looks different on every kiddo. So if you think that there's anxiety going on, it would definitely be something that you would want to mention to your doc, because anxiety can look a little bit different on kids. It's not always going to be something that is the same for every kiddo. And then, do they seem to hit a plateau in advancing in school or therapy? This is one. I have a lot of parents that are in therapy, that do therapy before they come into our practice. And sometimes they hit plateau where they're just not making the strides that they used to be. And that's just body not just kind of dysfunctioning, right? And so when they're under care, when you bring your kids into to a doc like myself, what we do is we kind of work at easing the body and taking those burdens off so that their brains can function better, so they're back to doing better in therapy, overcoming those obstacles quickly, and of course, checking that list off of all their goals that are met. And of course, is there any sign of any issues with their skin, reoccurring or otherwise? Bloating in their tummy or bloating in their body, and of course, dark circles under their eyes, as you know, are a sign of some kind of food sensitivity or allergy. So this is a great little list that you can go through. And if any of these are a yes, I would seek care. No question about it. So nutrients necessary for growth and development. This is a question I'm asked a lot. I just did a YouTube video a couple weeks ago on my top supplements that I like the best, and saying any kid could take them because the rest of supplements are usually very much geared toward that kiddo. So the American diet, those of you that may know that we have not had a study yet that has shown that we get all the vitamins and minerals we need for optimal health through food alone. I know that there are some parents out there that buy all organic, that cook from home, that don't do processed food, that, you know, go to some kind of co-op and get their food fresh. And I get it. And I say, you know, high five. However, unfortunately, they're still not getting everything they need. I wrote a whole paper about this on our website. If you have trouble finding it, you can go under the Healthy Kids Nutrients tab on our website. And I actually wrote a whole paper about this and bringing together all the studies. So it's kind of a nice way to look at it all as basis for the multivitamin that I formulated. So typically every study reveals some sort of deficiency or suboptimal intakes of nutrients. So we don't want you as patients to be deceived into thinking that your kids are going to get all the vitamins and minerals and antioxidants that they need in food alone. So there just isn't enough research or proof out there that that's the case. So what do? We want to make sure that if you're going to take supplementation, that you are going to use something that's biologically active, This basically means that the nutrient is absorbed more easily and then utilized properly. Not everything that you buy at the health food store is good. Just because you buy it there, that doesn't mean it's good. Just because you pay more money for it doesn't mean it's good. A lot of those companies do not have to be, they're not babysat. And I'm only speaking in the United States, but there's no one that's babysitting them to be able to say that there's 30 milligrams of vitamin C in that or 10 milligrams of B2 in that. Nobody is babysitting them. If you're getting your supplements through your doctor, they are ordering through companies, hopefully, that are GMP certified, which means someone's babysitting them. They're doing quality control to make sure that what they put on that label is exactly what you're getting. And that's what you want. If you're going to spend your money, you got to spend it wisely and you have to make sure it's working. The best examples that I can give of this is active forms that most people will see is they'll see vitamin B12 on their label. Methylcobalamin is the active form of B12. And we want to make sure that you're getting the active form. The other one that's become a much more hot topic with the realization that many of us have the MTHFR mutation is methylfolate. So that is your bioactive form of folate. And so if you see folate or folic acid on your vitamin labels or in your processed foods that are fortified with folic acid, that means they have synthetically put folate into that. It's a synthetic form that your body doesn't recognize. So that means it's not available to the body and it doesn't get absorbed. So if you're thinking what I'm thinking, yes, you're wasting your money. So if your current supplements don't contain your active ingredients, or you don't know when you go in for that first appointment with your doctor or the next time you're seeing them, just say to them, can you make sure that the things that I'm taking are of good quality, that they're bioavailable, that they're going to be absorbed well. Because spending another $5 on something to get something that's better isn't really that big of a deal in my mind, but spending $25 to give my child something that isn't going to work is a humongous waste of money, right? Couple products. This is what I talked about in the webinar. I'm almost at it. First one is, this is actually a multivitamin and mineral that I formulated. I gave you this slide, so I'm not going to go through it all. But I will tell you, this was a very hard thing for me to do. It took about 8 months to get all of the ingredients, the raw material, if you will, for it, because I wanted to do a capsule form. And I do have kids from infants on up. But what's hard is to do a liquid, you have to suspend it in some sort of preservative. If you do chewables, most of them are sprayed with corn, corn, which is the maltodextrin that goes on. So if I did a capsule and just opened it in lemonade or orange juice, which is what we do with our multivitamin. It tastes great. I could keep it free of any preservatives. I could keep it free of artificial flavors, sweeteners, and colors. And of course, it's a vegetarian cap for my kiddos that swallow, and it doesn't have milk, eggs, fish, peanuts, wheat, corn, soy, stearates, or preservatives. So I'm really excited about this, and we have seen really good results with it. It's been out since about January, end of January. So, of course, it's got all biologically active forms of nutrients, and it has the best form of folate on the market right now, which is called quadrafolic. And it's got everything that you would need in it. So the great thing is, if you're going off gluten and casein specifically, a lot of parents are worried about things like magnesium and calcium and vitamin D, and so it has all of that in it. So this is a really great thing that is safe for kids. I would say age 2 and up. And so you can actually go to our website and look at the dosing on the healthykidsnutrients.com page and look at what the dosing is for it, and you can order it there. The best part is that I was able to keep it under $40, which is great. And some of you that don't get vitamins for your kids, you may not think that's great, but it really, really is. The stuff I was using before was around 45, I think, or 46. So this is 38. So that made me super happy to have such a high quality multivitamin be affordable. These are the other couple things that I would call like in my arsenal. I love Speak Nutrients. This is an omega-3 fish oil, and it's really amazing for supporting neurological health, like we talked about earlier. So also I see behavioral and cognitive changes with this when kids start on it. So this is one of maybe 3 fish oils I use in the practice, but predominantly this is the one I recommend for the kids. And this, again, these are available on our website. We actually sell Speak through our website for them, just to make it easier for parents to get everything in one place. And then multi-strain probiotics are really important. Not always about how many billion can you get into one cap, which I know has become the predominant thing. Parents want to make sure there's 25 or 50 billion, and we certainly have those. However, it's more about the variety of the strain that you have. And I have noticed more and more last 3 years that there are a lot of kids that their bodies cannot take those really high multi-strain probiotics. So we have a few in the line that have like 3 or 4 strands versus 6 or 7. So we're trying to kind of cater to those kids that have a little more sensitivity. Enzymedica is my favorite digestive enzyme company. And the one that we use most common is called Intolerance Complex. They also send samples. So we actually send all of our new patients home with samples of all the basics that we can. Usually 3 of the ones that we start with, we send them home with. So for you docs on the phone, it's really nice to be able to do that, because parents can try a couple things. And it also gives you a little homework to go home and try to figure out. I think all of these, to what I use as caps in the practice, again, just to avoid all the garbage that I want to, but lemonade and orange juice are magical. They really, really are. So when I use those, it's with great success. I did a YouTube on how to how to mix and give children supplements. So if you're struggling, or as you start to do that, you can always refer to that YouTube video as well. And then the last one is a buffered vitamin C powder. This is really great. I love it. I currently use Designs for Health BioFizz C powder. One of my favorites. It is kind of sweet. It's a buffered form, which means it's really gentle on the tummy, and it's very, very nicely, and it tastes good, which kids really love too. So you can get most of these on our website directly because we have some partner brands that we carry just to make it easier on the parents. And of course, you don't have to be a parent in our practice to order those things. So I wanted to go through these type as we kind of wrapped up. This is an 8-year-old male, and the chief complaint was aggression. This is one of those parents that had to begin to homeschool because they got kicked out of school. They were sick every other week, which they thought would get better when they weren't at school anymore, but that was still continuing to happen. They began picky eating at 12 months of age. Behavior issues, just, this looks like a joy, doesn't it? Biting, banging their head, throwing toys, and the tantrums would last up to an hour. And the parents would say, well, it's really just about when he doesn't get his way. But that isn't normal behavior. Really, people say terrible twos, and sometimes that goes into the threes. But typically, if they're biting and angry and throwing and it's an hour long, it really, really isn't normal at any age. Sleep, he had trouble with waking at night and had a hard time falling asleep. So both of those questions that we went through earlier were yes, they have trouble with both. So that would be a problem. And then, of course, diarrhea, onset at birth 2 times a day. She had told me at the visit that it'd been basically water the past few weeks. There was a bad odor, and occasionally he was bloated. So when I examined him, he had eczema on his face. He had dark circles under his eyes. He had a subluxation up at the very top of his neck, which I fixed chiropractically, and his lymph nodes in his neck were swollen. And that's probably just because of the immune stuff. With adjustments, it's amazing when you have kids that are sick, whether it is sinus infections or ear infections or sore throats. It's amazing what an adjustment to your child can do to clear out and drain all of that crud in their head. So I always tell parents, if anything, find a chiropractor that sees children and get in there and go see them, and have someone like that to go see when your kids are acting up. I always say, to go in once a month would be ideal, because if they have fallen, the chiropractor can find what's going on before it becomes symptomatic, right? So treatment, we treated the diarrhea, which I believe was, we treated it from a parasite standpoint. Naturally, we did actually dysbiosis, which basically means imbalance. So this could have been, when I say dysbiosis, it's just a fancy medical word for the gut's imbalance. So not enough good bacteria. There might have been candida in the system. So we would have given probiotics to reestablish good gut flora, and then also worked with the family to remove the candida from his gut. Addressing gut inflammation with supplements. There's some great supplements that we use to help decrease the inflammation in the gut and give everything a little bit of a break. And then behavior and aggression can actually be treated naturally. In this case, we found out that he had low cholesterol. And there's actually a blog on cholesterol on our website. If you go to our blog and in the search button on that right-hand side, you can type in cholesterol and read about it. But low cholesterol has been linked to difficulty with behavior. So we actually gave him cholesterol in a cap, which I know sounds crazy, but it works beautifully. So who would have ever thought that this kid's aggression was in part due to low cholesterol? When we have our cholesterol ran as adults, we're always worried about it being high, right? I run it because it may be low. So this is something to note. And then we coached the parents through giving supplements, as this was a really big struggle for them. So they kind of came in, we want to get him better, but we have no idea how we're going to make this work, because at 8, there was a lot of stuff, as you can just see from the chief complaints, that he had going on. So we really had to coach them through how to ramp them up and what to do, just so that they could be successful. And every one of our families is different. The results, a month later, he had not been sick, which was awesome. He was sleeping through the night. Bowel movements were normal. Eczema had cleared. He was eating more and was socializing and playing well with others. So not quite back at school yet, because it had only been a month, but the behaviors were absent, and he seemed to be a much happier child. We weren't in the clear even 30 days later. And this is a case that flipped very, very quickly. Not all kids flip this quickly in a good way. But sometimes I explain it to parents. Sometimes kids come into my practice so broken, especially by the time they're 8, so broken that when you give them very basic things and start filling in those deficiencies and gaps and changing their diet, they get better so fast because their bodies were just starved for it. And in this case, that's how I think he was. His body was so broken that anything I would have done would have helped, barring I'm doing the right things, right? But any little bit of things I would have done to help him with those things that were going on in his body would have helped. And they did quite quickly, which is just awesome. A lot of information that I talk about in these webinars, I actually put in my book. I wrote the book specifically for you all, parents, and of course for docs to use as education as well with their parents. But I kind of start from infancy and go all the way through. And I talk about questions answered about developmental delays is kind of the subtitle, because I think that you can keep a child from getting a developmental delay or a behavior issue or an immune disorder very early on if you know what to do, you know what to look for, and you know what questions to ask. So the book kind of takes you through a lot of kind of my methodology and practice, my experience, and then of course a lot of cases are in there kind of bringing the reality to the science, if you will. So it's right under 200 pages, super easy to read. All of my patients actually get a copy for free because I really want them to use it as an education tool. It saves them a lot of money from sitting in my office having these conversations with me. And then, of course, docs, if you want to use it in your practice, if any of you are on the phone, I do offer a discount to you when you buy in bulk so that you can maybe roll this into your visits and share that with your parents. It can really be useful. I usually assign parents chapters if I feel that there's something really strong that they needed to read about right away. And then, of course, our supplement line we talked about a little bit about tonight, that's healthykidsnutrients.com. We do offer free shipping for orders over $150. The next course coming up for parents that's free. And please share this information with your friends and family because it's open to anybody. It's going to be June 23rd, and I'm going to do what the MTHFR, which is a genetic mutation that 40% of us are walking around with. And we're going to talk specifically about how it affects development, cognition, detoxification, and supporting pathways. So we're going to talk a little bit about the problems and what it can do, and a little bit about the pathways and supplements that are commonly used to help. If you have MTHFR or you don't know what that is, and this is the first time you've ever heard of it, please go to our website and read about it. We have a whole page on MTHFR and lots of research on there as well. There's a lot of behavior issues that are tied to this. So I really am excited that this happens to be next month. A lot of my patients and a lot of people were asking, when are you going to do this again? Because I tried to record it in February and messed it up because I'm technologically challenged sometimes. So this will be coming June 23rd. I'm super excited. This is going to be a little bit longer than normal. It's going to be from 6:30 to 8 because there is so much to talk about. So we're going to extend this one. And of course, to parents, it is free, and to anyone else that wants to attend. For docs that are on the phone, my next webinar for you all is actually next week on the 19th. And we're talking about pediatric evaluations, making those easy and how to do those quickly and efficiently in practice. That's not on here, but you can register on our website. And then, of course, in June, I'm doing one treating common childhood symptoms uncommonly. And the cost for clinicians is $25. And of course, this is only open to clinicians. So I'm sorry, parents, you're going to just have to stick with the free ones with me. And hopefully you'll be either coming to me or going to somebody that's taken some of these things either from myself or elsewhere. But you can always be in the loop with what's going on in future courses at dramberbrooks.com under education. I also have recorded webinars that we have done in the past that you can go back and listen to. So you can take a look at those that we've already recorded. Here's ways to stay in touch with me. Of course, we kind of already discussed in the beginning. So that's office email, office@mychildwellness.com. If you need any assistance at all, whether that's a patient or a referral or something like that, please feel free to reach out to us. We're usually good about getting back to you within 24 hours. Hardly ever do we not, unless we're not in the office. So want to thank you so much for joining me this evening. I will take questions because we have a few minutes left. So if you guys want to type in any questions that you have into that little bar on the bottom, I will answer those for you. So does anyone have a question before I let you jam? Okay, I don't see any questions, which is abnormal. So either I did an awesome bang out job at explaining it all, or I made your head spin either way. So what I'm going to do is, if you can give me just a second, I'm going to give you the link for the info for tonight. So you will see that show up as a download that link that I just clicked, you can click here. You can click there and you can get it. And then of course, those of you, when you hang up, you will also be able to see